My name is Ash Panchal. I am an ER doc and an EMS physician at The Ohio State University. I'm also the Research and Fellowship Director for the National Registry of EMTs. The reason I'm here today is I want to talk a little bit about the practice analysis. The practice analysis is the way that we understand what's happening in EMS care. So when an EMS professional goes to a scene and acts and does everything which is normally in their practice, that's the information we really want to know. We want to know what an EMS professional does on a daily basis so that it can inform what we're doing on a national basis. The National Registry conducts the practice analysis as a service to our community. It's done in partnership with NHTSA and a lot of EMS stakeholders throughout the country. The big reason that we use the practice analysis is that it informs so many different parts of our national perspective of what EMS care is. And as an example, when the National Scope of Practice model was developed, the National Registry's practice analysis informed them about what EMS providers were doing at each of the different levels so they could make their decisions about what practice should be like. This is also going to be true for the EMS education standards. And of course, when all is said and done, we use the practice analysis to inform us about what should be on the certification exam. Because when all is said and done, the certification exam must reflect what the practice of care is out on an everyday basis. I love the question because I think practice is one of those things that seem like it moves very slowly, but in reality, the practice of EMS care is changing so dramatically that on a daily basis, we find that there's new data and new things which are informing what we're doing as practitioners. And our medical directors across the country are changing their protocols to fit that whole characteristic. One example is spinal motion restriction. In the practice of our trauma care, we have done a lot of evaluations about what's the best way to immobilize a patient. We've found now, and joint statements have come out, that spinal motion restriction is the best way to go about it. Now, when we ask the same question to current practitioners of EMS care in the field, both paramedics and AEMTs, and we ask them the simple question, do you still immobilize patients on a backboard? The answer was overwhelming, that paramedics 60% of the time would immobilize patients on a backboard, and AEMTs 60% of the time in their normal practice would immobilize patients on a backboard. So we see a difference between what the research is, how it's disseminated, and what the true practice of EMS care is in the field. What we want to reflect when it comes to the test, when it comes to what the National Scope of Practice model individuals make a decision on what the practice should be, is the true practice of EMS care. On a daily basis, I think we all recognize that practice changes. And if we don't reflect that in the way we assess each other, in the way we train, all those different things, and that's where you're going to see it. You're going to see the effects on what training comes to you and what kind of new strategies that we do to take care of patients. That all comes down, and it starts with the practice analysis. So you'll probably be seeing through the summer and into the fall some information about the practice analysis and the outcomes from the practice analysis. The most exciting piece is really engaging our EMS professionals across the country about defining what the practice is through the practice analysis. And it's been an exciting exciting time for me to be able to do the work and actually be able to interface with so many professionals.